Good day, everyone. Jaquel Wimbush here, your host of Back to the Basics of Health and Wellness. And we are here today with Dr. Devin Miles as we talk about what she does, how she does it, and how did it begin. Let's get into it. The cells in your body react to everything that your mind says. Negativity brings down your immune system.
Daddy, it's time to start your podcast.
Hey, Dr. Miles, how are you feeling today? How's everything going?
I'm doing good. How are you, Jaquel?
All is well, all is well. Welcome to the show, Back to the Basics of Health and Wellness podcast, as we talk about the basics of health and wellness. So let's get into it. So, how did you get into, what started you to become a doctor? Like, what was that thing?
So I started having digestive issues at 21 years old.
Mm-hmm.
I was in business at the time. I was not looking into medicine at all. And so I started, just having a lot of constipation out the blue, random bloating, gas. And then it just got worse and worse. So I went to a gastroenterologist during my first job out of college, and was dealing, just trying to make a good impression at my job, and then also feeling like, something is going on. So I went and got a colonoscopy. There wasn't anything wrong, but I was still having a lot of symptoms, and these symptoms were getting worse, and I was having different symptoms in multiple areas of my body. It wasn't just like my digestion. But it was still more concentrated within my digestive system. So I started getting multiple colonoscopies because there was no other way to figure out what was going on. My blood work looked fine and everything. And then I got a second opinion. I went to a second gastroenterologist, and he diagnosed me with IBS.
Wow.
But there was no cure, and there was no understanding of what happened, why this happened, where it came from. So I got inspired by family members to go to this health food store that it was on my block that I had never seen before, because I was living in New York and had tunnel vision when I would walk along the streets, and I didn't see, I didn't see the sign. But yeah, I went in there, and the owner had IBS. And so he was the first person to give me hope that something could be done. He suggested a few products that were in his store, and I saw improvement. So From that point on, I started delving into natural medicine myself. I realized I had an interest in it more than what I was doing at the time professionally. And I started to look into schools, and I had gone to a nutritionist per a referral from the second gastroenterologist. Now that I'm on, several years post that, I realized that she was an extremely basic nutritionist. There are a lot of advanced nutritionists out there that are doing great work, but she was a very basic one, and told me to just get off of certain foods that are commonly known to cause gas. But my situation was way beyond that at that point. Like, me just pulling out broccoli and beans wasn't going to fix what was going on with me.
Absolutely.
So that's all I knew at the time. So I was looking at I think it was Columbia at the time for nutrition, a master's in nutrition. But I also happened around that time to discover naturopathic medicine. So I started researching that, and it was a very comprehensive form of medicine. And I had been to a naturopathic doctor. So by that point, I was just kind of like, yeah, this is it. This is what I want to do.
Nice.
So that was the beginning of me going to school and becoming a naturopathic doctor.
Beautiful, beautiful. And shout out to all the health food stores out there that get us started on our journeys out here. You know, that a health food store got me on my journey to be a health coach. So, and you know, like Dr. Jaquel said, you know, she got started from going to a health food store herself. So shout out to all the independent health food stores out there that's keeping families healthy and keeping their locations and in the places that they're at safe. That's a cool thing. Beautiful, beautiful thing. So when it comes to IBS and you dealing with IBS, you decided to specialize in IBS. Is that correct?
Mm-hmm. Correct.
Okay. Yep. So I guess with you going into that, you know, it was very familiar territory. As far as like, I guess the people that you see, how many people are affected by IBS? Well, not even the people that you see, but just people in America. How many people in America are affected by IBS in America right now?
So IBS, I would say it's more common than people realize. And when I talk about IBS can somewhat be a catch-all for people who are dealing with chronic digestive issues that don't necessarily fit into a diagnosis like Crohn's disease or ulcerative colitis. There are a lot of people beyond the statistics that are experiencing chronic digestive troubles. And so this is actually more common than you may realize. There's probably at least one or two people close to you that are struggling with this and you don't necessarily know. And it can look like just chronic indigestion, chronic constipation. You're sensitive to certain foods. Sometimes it's just as minimal as lactose intolerance, but there's probably other things that bother your stomach that you're not aware of. With digestive issues, they can go beyond, the symptoms can go beyond obvious digestive symptoms. You can have symptoms in other areas of the body. And so the beauty of working on the digestive tract is that I'm able to help a lot of people because I understand that the digestive tract, when it is healthy, the rest of your body can be in a much better state.
Absolutely.
Because the digestive tract houses about 75% of your entire immune system. So what's going on in there can affect many other chronic illnesses as well. So IBS sometimes is really it's a starting point for people. And because I specialize in it, it's something that I'm always looking at as well. So it's not always about, okay, this herb for this condition. It's also about understanding the connections that the body has. Most people that I do notice with digestive issues tend to be women. However, there are a lot of men out there who are also struggling with digestive issues. I think they're a little bit more quiet about it, but that doesn't mean that it's not happening. And sometimes we have these situations where we just think it's just something that we just have to deal with and we just get used to it. Like, I remember watching one of the Red Table Talks with Jada Pinkett, and she said that she typically did not eat much. But the reason that she did not eat much is because she had a stomach problem. So again, there's different adaptations that sometimes we do to cover up something that's going on. And so I think it's very common.
Yes. And you know, I see a lot of people run to the Bragg's apple cider vinegar when they say, oh, I have a stomach issue. You know, like what would be like a recommendation for somebody that may have irritable bowel syndrome, which is IBS, for the people who don't know. You know, what would be a recommendation for them to look into first if they feel like they have something going on?
One of the first things that I would suggest is to pull out very common food sensitivities. So it would be an elimination diet. So the first, and this is what I did without knowing specifically what common things to pull out. These were like, I just started limiting certain things that I was eating. So gluten is number one. Gluten is a protein that is found within wheat, rye, barley, and if you're extremely sensitive to the point like someone with celiac disease could be, where they have a true allergy to wheat, then you would have to also consider pulling out oats or having oats that are marked as gluten-free.
Yes.
Now, for some people with IBS, it may not need to go that far, but you still want to get a good quality type of oats if you're going to eat oatmeal. So gluten can be in wheat, rye, barley, and the cross-contamination of oats can make it also suspect. So gluten, particularly in wheat, is wheat. It has become a crop that is highly ridden with pesticides, and the way that it is harvested is not the same as it used to be. The way we make our bread is not the same as it used to be. The way we used to make our bread, we would break down the gluten a little bit more through the use of what's called mother's yeast. So because all of these things are different now, the gluten is much harder to digest. And particularly in a situation where you may have a genetic predisposition for a weak digestion, gluten is going to make things worse.
Absolutely.
And gluten you can look up different things online, and it's very well known now that gluten and mental health challenges are very much correlated.
Wow.
So particularly with irritable bowel syndrome, a lot of these clients have, at a minimum, mood swings. They have anxiety, they have depression, their stress tolerance is lower, usually. And particularly when they start having the symptoms, that stress tolerance can be even lower. So gluten is one that I definitely take out first. And that was the first food when I started paying more attention and researching after I had done my initial elimination. Gluten was the first one that I realized, I need to pull this out, because I kept trying to eat one healthier cereal after another. And then I realized through research, the common ingredient in all those healthy cereals was wheat.
Yep.
And so I literally went from having bowel movements that were green with red blood streaks in them to, nice bowel movements that were not full of blood.
Yeah.
And so it can make a big difference. And gluten was people were thinking about this as a fad. This is not a fad for people who actually have symptoms from gluten. And so gluten is the first one. Dairy would be the second one. Most people actually do become dairy intolerant, and that's even beyond lactose intolerant. Lactose is the sugar that is in milk, but people can get tolerant to dairy in general. So beyond just the sugar, they could be intolerant to the protein. So that was another one for me that I pulled out very early on. I was having nightmares actually from dairy. And so I pulled that out. And then the other ones would be like soy, sugar, processed sugar, corn, and for some people, nuts and seeds. So that's like a very basic list. But that would be the first place that I would start, because then you could start to notice that you can have some symptom relief just from pulling out certain foods. There's more that goes beyond that, but that's the first ways that you can get very quick relief.
Absolutely. And people, for the listeners out there, there is gluten inside beer as well. So, just be careful. Be careful with your alcoholic beverages, because there is gluten there. And if you do want one, you have to, specifically ask or do your research to find out which beers or, alcoholic beverages don't have gluten in them, so you could be safe out there. And for me as well, on my journey, I did my own elimination diet and found out a lot of the things that I was eating was affecting my gut. And I'm like, oh man, and then now it's to a point where I don't even look at those things like dairy products and things like that. It's like I just sidestep. I'm like, it's nothing. And I try to, teach my clients that as well, during their elimination diet period as well. Yep. So, and the other thing that you go into and you specialize in is kidney disease.
Correct.
What's going on with kidney disease in America right now?
Kidney disease is very prevalent, and the reason for that is because the kidneys in conventional medicine are considered an organ that cannot regenerate itself. So it's not an organ that will just heal itself like the liver can. The liver is to a large extent self-regenerating. It can rebuild itself and be healthy again. But once the kidneys are damaged, conventional medicine doesn't have an answer for that right now.
Mm-hmm.
And so if you have something like a high risk condition, a condition that would put you at high risk, like hypertension, diabetes,
Yes.
lupus, these conditions can cause kidney damage. So this is what happens is that the kidneys start to get damaged, and then you go through the different stages of kidney disease,
Wow.
which is stage 1, 2, 3, 4, and 5.
Mm-hmm.
4 and 5 is when a nephrologist would start suggesting to you to get on dialysis.
Wow.
So, but before that, though, there's not a whole lot that is being done, and so it's kind of just a waiting game. I get a lot of clients coming to me saying that they just found out that they have kidney disease and that their kidney disease stage 4 or 5.
Wow.
And I think there's a lack of communication about when people are at stages 1, 2, and 3, because of this lack of insight as to what to do about it. Whereas for me, as a naturopathic doctor, there's several things that I can do to help preserve kidney function. And so I like to encourage people to understand their numbers. I have an ebook in which I teach them about that.
Nice.
And then they can be proactive with those numbers, maybe even more proactive than the physician that they might be seeing, and look at, okay, what can I do naturally to help? But of course, if you have a condition like hypertension, diabetes, or lupus, yes, definitely work with your physician, or you can also work with me to address those conditions. Because when you're working with kidney disease, one of the best things you can do is address the trigger for kidney disease. Because if it's hypertension, if all you do is try to heal the kidneys, but you just let the blood pressure just go out of control or fluctuate continuously, you're always going to have something that is damaging to the kidneys. And so you want to relieve that as well. So that's why kidney disease is pretty high. It's because sometimes the blood pressure is not being controlled as well as it should.
Mm-hmm.
The blood sugar is not being controlled as well as it should, and lupus is not being regulated, right? So you still have to manage your health even before there is such a thing as kidney disease if you're trying to prevent that from happening in the first place.
Okay. And why does it take so long, or why is like stage 1 and 2 overlooked, or is it not, or like are doctors not finding it at stage 1 and 2, and then once you get to 3, 4, that's when it's like on the surface and you can really figure it out?
So they are able to find it, especially if they're doing just kind of routine blood work.
Mm-hmm.
They can definitely see it. And this is why I teach people how to do it themselves, because
Nice.
it's pretty easy to monitor your own kidney function. However, because there's not anything that per se can be done other than managing the condition. So if you have blood pressure, then of course your physician's going to be on you about, let's get this blood pressure under control.
Mm-hmm.
Because that is part of protecting the kidneys from damage. And they do know that. But if you're already at like stage 1 or 2, it's more just, okay, well, let's just try to preserve what we can. But the idea is that eventually it will progress.
Okay.
And so the conversations that I hear my clients tell me about that they've had with their physicians is more like, 1, they never said it, or 2, the physician will say, oh, you're okay, it's not that bad. And then number 3 is that there's this idea that if your GFR is above 60, in a lot of cases you're okay, especially if you're getting older, because your GFR can reduce with age.
Okay.
And it has nothing to do with there's something else going on like hypertension or diabetes. So the conversation is one that lacks urgency, that lacks desiring to inform the person in front of them.
Okay.
And so when they find out, then it's like stage 4, stage 5, because now there's something that can be done, and that being dialysis.
Oh, so, yeah.
So that's why I like to advocate for people to understand what kidney disease is, what what puts them at high risk for it, and how to monitor their own numbers so that they can be proactive about it.
Mm. And when they go over to dialysis, that means more money coming out the pocket to spend on that treatment, correct?
Yes, and time.
Yes, and
because
time.
it's a like 2 or 3 times a week or
Oh,
4
wow.
times a week
Wow.
that you have to do dialysis. So you can go into a dialysis center and get that done, but there's also home dialysis, which makes it, of course, more convenient as well.
Okay.
And for some people, I mean, at the end of the day, dialysis, there's a lot of people on dialysis. It can be a lifesaver. And so it's not to take away from the benefit that it can provide, but at the end of the day, there are solutions to where that level of care is not necessarily needed. It doesn't have to be that way. Or if it is going to be that way, you can prolong that for a much longer period of time than what is commonly known.
Okay. Good information. Why would, a lot of people, they know about naturopathic doctors, but they know about, regular doctors, but why would someone want to come see yourself as a naturopathic doctor or a naturopathic doctor in general?
Right. So we as naturopathic doctors, to kind of just give you a little bit of background, we've been around since the early 1900s.
Nice.
And for some people, the word naturopathic is new, but we've actually been around for over a century now. So this is not new. What we do is not new. There was a guy named Benedict Luce who decided to put a number of different pre-existing therapies together that he saw were very synergistic, and decided to say, okay, this is naturopathic medicine. This is the basics of naturopathic medicine. So what we are is essentially a blend of conventional and holistic medicine with a focus on addressing everything as naturally as possible. We understand many of the connections of how the body works.
Yes.
We understand that different parts of the body can affect something entirely different. And so the way that we work is, it's not, if you ask us, do we treat this condition? Some naturopathic doctors may say, well, it's not about the condition. It's about me addressing your body, and then the condition will improve.
Yes.
Because what we're trying to say to you is not about the disease, it's about the connections of your body and bringing your body back into a place of balance.
Yes.
So sometimes people have different diseases because, there might be some sort of genetic predisposition for that, but that doesn't mean that you have to just go with these genetic predispositions. Sometimes how you take care of your body and having the knowledge of how to do that in the first place, that can be pivotal in helping your body to stay in a place of health versus in a state of disease.
Wow. Mind blown. Yes. We need that type of information out there for everybody to understand and research on their own. I thank you very much. Dr. Miles, how can people get in contact with you if they want to contact you to see you and, just talk to you about some things?
Right. So I offer telehealth consultations, so I can see anybody, anywhere. And they can reach out to me through drdevinmiles.com. They can also keep in touch with me, follow me on Twitter, Instagram, and LinkedIn. Twitter, Instagram, and Facebook at drdevinmiles.
Okay, good. And you're on TikTok, correct?
Oh, yes.
TikTok,
I just got on
TikTok. Gotta get that TikTok out there.
yes, I am there.
Beautiful.
And it's the same name at drdevinmiles.
All right, guys, and I'll, as I normally do, I will definitely have that information for you guys in the show notes. Dr. Devin Miles, it was great having you on today's episode, and a lot of information was put out there for the people. So I thank you so very much for coming on.
You're welcome. Thank you for having me, Tiquel.
You're very welcome. And I'll definitely have you on again soon, and we could talk about, something more in depth and, just, or it may be about, a month of kidney disease month or, something in that nature. And I'll definitely have you back on the show.
Great. I'll be glad to do it.
All right. I'll talk to you soon and have a great one.
All right. You too.
All right. Hey guys, I would like to thank you all for joining me on today's show with Dr. Devin Miles, ND. Wow, that was a great one. Some good information was put out there. So I hope you guys took that information down, wrote some notes. And like I said, if you need to get in contact with her, I will definitely have her information in the show notes. And until next time, enjoy, be well, and continue to make a lifestyle change that lasts. Have a great one, everybody.